Hi, my name is Jim and I was retired. Next month I start Medicare, but as a couple with a younger spouse, I've discovered that there's a little hiccup. As you go from ACA to Medicare, there's a catch-22. If you're a baby boomer, you understand the reference to catch-22 from Joseph Heller's novel and the movie from 1970 of the same name. I'm sure you're familiar with it.
There's a catch. A catch. Sure, catch-22. Anyone who wants to get out of combat isn't really crazy, so I can't ground him. Okay, let me see if I got this straight. In order to be grounded, I've got to be crazy. And I must be crazy to keep flying. But if I am to be grounded, that means I'm not crazy anymore and I have to keep flying. You got it. That's catch-22. It's so fancy, catch-22. It's the best there is.
So here's the Merriam-Webster definition of catch-22, and Joseph Heller's term really did enter the lexicon. Heller's novel follows the exploits of a bombardier in World War II, and in so doing shines a light on the relentless and circular bureaucracy of war and wartime governments. The term is introduced to describe an apparent loophole or catch that prevents a pilot from asking for a mental evaluation to determine if he's fit to fly. There's only one catch, and that is catch-22. If you ask to be grounded because you're crazy, you're sane. And if you don't ask and you're crazy enough to fly, you're crazy and you're still flying. Catch-22. Well, I'm in something similar, although my catch-22 is going to be a catch-22, catch-23, catch-24, and catch-25, since my spouse is nearly 4 years younger than I am. Let me show you what I mean on my catch-22 as we go from ACA to Medicare. Now, all this stems from the fact that we're on ACA for our health care prior to Medicare. And for the last several years, we've been containing income to make sure that we qualify for the premium tax credits and can afford health care as a couple with no other resources for health care. And as you may know, this year, 2021 and 2022, the tax credits actually have been expanded to allow credits even if you go over the 400% of the federal poverty level. So this year, I went all the way up to $99,000 worth of income. And now, as you know, I'm about to start Medicare. But I still need to buy ACA coverage for my wife. And here's the catch-22. The income for the household determines how much premium credits you get. But it's a different scale if you're only buying coverage for one. And so $99,000 worth of income in the coming year, and I'd see a pretty expensive bill, about $860 for just one person. I built some tables here to illustrate the dilemma and what I'm going to do about it. Follow along. So here I started with a simple table that shows you the trailing 12-month expenses from my Quicken data. This year, we've been spending about $788 a month on insurance for the ACA coverage for the two of us, and the co-insurance and co-pays for doctors and pharmaceuticals show up in the doctor and pharmacy budgets. And then eye care and dentistry, we pay out of pocket, no insurance for those coverages. So the total medical expenses this calendar year is going to be roughly about $14,500 for us. So I've been budgeting around $1,250 a month. Next year, I'll be on Medicare. So let me jump over here to this one on Medicare for a summary of what I've signed up for on Original Medicare. Medicare surprised us with a very hefty increase in the Part B premium for 2022. I had been expecting about 158 according to the trustees report, but it's 170 a month. Now, my Medigap policy, Plan N, premiums are locked in for 12 months, as is my Part D prescription drug plan. So I know what those coverages are going to cost me for the coming year. It'll be $111 for Plan N and $36 a month for Part D prescription drug. Now, there are prescription drug plans out there for $7 a month. I could have gone with those, but I selected one for the total cost, premiums plus prescriptions, based on a mail order prescription. And this $36 a plan turns out to be the better buy for me. So that's about $317 a month in premiums, but you'll have copays and deductibles. And Medicare surprised us as well with a hefty increase in the Part B deductible. It's now $233, so that'll be the first $233 under Part B will be out of my pocket. Now, in addition, Plan N charges copays, $20 an office visit, and I expect to see an office visit about 4 times in the coming year. So let's say that my doctor expenses are going to be the addition of those two things, the deductible and the copays. My out-of-pocket is going to be about $313. And I know my prescription costs are projected to be about $57, $58 a year for the mail order drugs that I get. Very generic drugs, so that's what I can expect. But that's me. Now we need to buy insurance for my wife. And when I first looked at the premiums for maintaining about $99,000 worth of income, I was shocked. So I went to the Get Covered NJ and entered some numbers to calculate what the expected premium would be for income of $99,000. And I was quite shocked to see that it'd be about $860 a month just for covering one person. That's about what we spent for 2 this year, 2021. So I went through and entered a series of potential adjusted gross incomes. It starts as low as $45,000, and I went as high as the top of the 12% tax bracket. Now, for each of those estimated modified adjusted gross incomes, you'll get premium tax credits and some New Jersey credits. The premium for the Silver Omni plan that we've been on for the last few years is this, and that gives you the total monthly premium based on the amount of credits that you're getting. And there's a big range here. I plotted it all out, and as you can see, there's some breakpoints. There's a breakpoint here where the New Jersey credit goes from 100 to 50 at $69,000. So let's start there. If we did that, if we kept our gross income about $69,000, the insurance for the year would be about $71.27 for my wife, $593.98 a month. This is what we would expect to spend on ACA next year for my wife if we keep our gross income at about $69,000. Stop! How do you keep it that low? Well, fortunately, I've got taxable and tax-free buckets that I can draw on. So I can decide how much taxable income I need to keep it at a certain level. It's the only way this is going to work. If I do that, we're looking at about $96.77 for expenses for my wife in the coming year. And now let's go to the Catch-22 snapshot of how this all adds up for a married couple, one on Medicare and one on ACA. So pre-Medicare, both were on ACA. We were spending about $14,500 total on healthcare costs. We're projected to spend this much on Medicare and this much on ACA, again, if we can keep it to the $69,000 gross income. That would bring our estimated total to about $14,900 in the coming year. Sounds reasonable, but let's play around. What would happen if we kept it at that $99,000 level? If we did keep our income at $99,000, like we did in 2021, we would be looking at $14,000 in just insurance costs. All medical expenses in the coming year would be about $18,000. That's a hefty increase. That would also take our monthly budget from about $1,241 in the coming year to about $1,500 a month. All of the increase is that $269 increase in insurance for the ACA coverage. And so, are there other alternatives? For instance, if we were about $80,000 in gross income, we could expect to spend insurance of about $87.35 for the ACA coverage. We would be spending about another $134 a month based on the model for $69,000. So I looked at the four scenarios: $99,000, which looks scary, $69,000, which looks most optimal, and then I added $80,000 and $85,000. And I figured my income to be in those ranges, and I plugged them into my retirement withdrawal strategy that calculates federal and state taxes. And I just made a table here of the comparisons. Estimated AGI, the estimated taxable at the federal level, the estimated federal tax, the estimated state tax, and then I added this line here of increased insurance, because the added insurance premium I view as just another tax. It's another place for your money to go to other people's pocket. And this bar chart then illustrates how much money would be going to other people's pockets under the various scenarios between estimated federal, estimated state, and increased insurance. Now, with the retirement income exclusion in New Jersey, there's not much difference in what I'll pay in state taxes if I keep the income all at this level. As you can see, the big differences are the added increased insurance premiums under the ACA subsidies based on the income you decide to elect. I could stay down here at the $69,000 level, and I would dramatically reduce the taxes that I'm spending from this year. I will likely end up around the $80,000 in gross. It's about the same kind of hit for other people's pocket as the current year, and I won't have to dip so deeply into Roth and taxable assets to make up the difference. But this is a decision we're going to need to look at each year for the next several years until my wife ages off this ACA system and into Medicare too. Well, I'll conclude with my standard warning. I am not a financial professional. I have no special credentials after my name, so take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need to. Oh, and be sure to like and subscribe to the channel, and go visit my Google Sites for downloads to links and PDFs from this video. Thanks for joining.